brain. So anytime that the blood supply is interrupted, the oxygenation, which is what keeps us alive, is interrupted. And therefore our brain tissue does not get oxygen and the nutrients that it needs. There's two types of strokes. And the type we're going to talk about today is the most common, and it's called an ischemic stroke. There is another kind of stroke called a hemorrhagic stroke. I'm just giving you information so you feel a little bit more knowledgeable. A stroke happens when a blood clot that generally starts in the heart or the leg or somewhere travels to the brain and either breaks the artery in the brain. So you have a rupture, a full rupture of the vessel. That's called a hemorrhagic stroke. And that's kind of identified in this picture with the kind of looks like little flowers actually in the red artery here. And that type of stroke is very, very, very serious, and it's less common. So we're not going to talk about that as much. The ischemic stroke is one where the blood clot is sent to the brain, and it just kind of creates a block in the artery. So it's kind of like rocks in a river, like they just kind of create a passageway that narrows the ability of the blood to flow through, and therefore narrows and decreases the opportunity for oxygen to get to those to the brain. So we're going to talk about, like I said, the ischemic stroke today, and that's the most common. And now we're going to look at something. This is really the most important slide, and I have it in here a couple of times because this is what you're going to remember. So I think I told you a few minutes ago that the most important thing about identification of a stroke is to be fast so that you can get help. So the American Stroke Association came up with this wonderful way to identify symptoms and signs, and using the word fast because you want to act fast. So here we go. The first letter of the word fast is F, and that stands for facial drooping. Facial drooping is identified by asking the person to smile, and you will see one side of their lips not really be able to smile. A lot of people have flat smiles, but you'll see one side significantly drooping and one side either smiles in a clean smile, or it's just their flat smile, however they smile, but you will see a difference. You'll absolutely see a difference. Okay. Now, it generally strokes happen on the left side of the brain and affect the right side of the body. It's the crossover that happens, the blood-brain barrier. So you will generally see this facial drooping when you ask them to smile. You'll see the side of their mouth, it's the right side, not being able to activate those muscles because it's not getting enough oxygen. That's F for facial drooping. The next letter is A. A is arm weakness. On the same side of the body that you may see the facial drooping, you will see arm weakness, and that is identified in one of two ways. You're either going to ask the person to squeeze your fingers on both sides, so the right side and the left side, and you will immediately, if a stroke, this is what's happening, it's a stroke, you will identify that the right side of the body, when they go to squeeze the fingers, is very weak. They probably can't squeeze those fingers at all. Another way to identify arm weakness is by asking them to raise their arm. So if their hand is down on their lap or wherever they're at, they probably can't raise their arm. It's too weak. The oxygen is depriving those muscles from getting that innervation to raise their arm. But if you raise their arm, you will classically see this. Their wrist will drop because at a joint, you're not supporting it, okay? This is called passive movement. So I am doing the work. I would do the work of the person, but I am doing the work of the patient. And if I hold my hand at their wrist, obviously it will stay up. But if I have my hand under their arm here, the wrist will drop. And so if you see facial drooping, you're going to call 911. But if you see facial drooping and arm weakness, and you're going to do this really fast, but this is how the American Stroke Association decided to come up with this. So F for facial drooping, A for arm weakness, S for speech difficulty. Speech difficulty is not a cognitive change. So you can ask the person their name, their phone number, their birth date, where they were born, all kinds of things, and they are going to be able to answer you properly. It's in the mechanism of creating the words where you start to see in a sentence, they kind of, the letters drop off at the end, or they're kind of slurring them a little bit. You really have to kind of be watching the person, because the speech difficulty is hard to visualize unless you're really looking at them. And then of course, T is time to call 911, and it works. This, acronym works well, but I like to back it up and say, if you notice the first one or the second one, or you just are like, oh my God, I think they're having a stroke, you call 911, because the timing is so important. And we'll talk about that in a minute, but you cannot call 911 too soon if someone is having a stroke. It's just so important to the outcome. Okay. So this is a visual of what the facial drooping looks like and the arm weakness looks like. So if you see the picture of the woman, you can see that one side of her mouth is not going up and the other side is, she has a pretty flat smile, but even when she's trying to smile, you can see if you flip her around, the right side of her mouth is drooping. She can't activate that. But it's important to understand, like I said, a lot of people have a very flat smile. So it's not like you're going to see this big tooth grinny smile. And then of course, the hand and the arm drooping, the arm weakness, and it's identified by a dropped wrist. Okay, classic signs. About 80% of the time, somewhere 75, 80% of the time, you will see these, this happen. Classic signs of a stroke. Okay, so you have approached someone that you think may be having a stroke, and you've called 911, and they are going to say, hello, this is 911. What is your emergency? And you're going to tell them, I think my XYZ is having a stroke, and these are the reasons why. And you're so proud of yourself because you've identified these signs and symptoms. And you have to know that when you call 911, it is answered by a dispatch.